Welcome to the Voice of Vicious podcast. Welcome to the Voice of Vicious. I am your host, Vanny Vicious. Guys, I'm sweating. Look at me on a microphone, bro. What the fuck? Hello, everyone. Welcome back to the Voice of Vicious podcast. Happy Friday. Thank you guys for tuning in. I'm your host, Vanny. You can find this podcast every Friday on Rumble, YouTube, Spotify, and Apple Podcasts. Just search for Voice of Vicious. We're also on X or Twitter, Voice of Vicious, and Instagram, Voice of Vicious Podcast. Anything you guys need to know will be in the description below. Today, I am joined by one of my besties, but also like the smartest person in the world, Dr. Christiana Marron. Hello.
What's up, Vanessa?
How are you?
I'm good. How are you?
Good. Thank you for coming, first of all.
Of course.
For those who don't know, I bother the absolute shit out of this woman every day. Because y'all know I'm paranoid about my health. Everybody knows because I be talking about this shit. But Christiana is my physical therapist. I've been seeing her. How long have I been seeing you?
Probably like 5 years, right? Because that was when you tore your meniscus.
Yeah,
I think that was the first time you came to me.
Probably. She also treated me for a torn bicep at one point. She's treated my horrendous Achilles tendon. Just life. I just go to her now and I'm like, here, take care of my hip. Today my ankle hurts, my toe, all of it. But I'm excited to have her on because we've had a few athletes on the show already. I haven't gotten to talk to them about really what they do for recovery. So I kind of wanted to talk about that. And not only just for athletes, but just for like the everyday person, because I feel like everyone can benefit from the information that you can share with us.
Absolutely.
So tell us a little bit about what you do.
So I am a doctor of physical therapy, and I am a mixture of sorts, I'd say. Mm-hmm. I really, in the past 8 years, I graduated with my doctorate in 2016, and I opened up my own individual one-on-one practice in end of 2017, beginning of 2018. And really it started because I got frustrated with the way the industry was going. Physical therapy, when I was into it, like in 2014, no, I was 14. I would say maybe, later 2000s, but you saw this shift where insurance companies are running the game, right? Mm-hmm. When it comes to the medical field. And I'll get into this when we talk about like athletics and stuff. So I knew that I was going to be an orthopedic specialist, and that was what I ended up doing later on in my career. And the insurance companies running the game didn't leave for that one-on-one doctor-patient relationship anymore. Mm-hmm. And, I took a job at a company when I first came down to Florida. So originally from New York, born and raised, went to school up there, came down here with my husband, Christopher. And it was just no job that I took was going to give me the satisfaction that I was looking for. Mm-hmm. I've been passionate about this since I was 14. And the medical industry changed, not just for physical therapy, but you know this, yeah, all across the board. And so I opened up my own practice. It's one-on-one. I don't take insurance. And the reason is because I want to spend an hour and a half with each client. Sometimes I feel like I could spend a day with a client. Mm-hmm. Because of how much they have going on and how deep-rooted a lot of injuries go, from a psychological level all the way to an actual mechanical problem. So, what happened is that I started really building this relationship, and it turned into this beautiful practice, and I'm so grateful for it. But the best part about it is I can have that one-on-one relationship with people.
Yeah, and it is awesome too because, like, I was in a car accident. Some of you know that have been following me or whatever. And I had to go to one of those therapy places for the insurance. And they would put me in a massage chair for 20, 30 minutes. And I would be texting Christiana, like, I can't wait to see you. Like, fuck this place completely.
Yeah. And, unfortunately, like, those are the places that you kind of have to go through that legal route.
Yeah.
To get other doctor's appointments, whatever that might be, whether it's surgery, whether it's, justification for an MRI or stuff. But as the industry has also changed, I've gotten more under my belt as a doctor where now I can get someone an MRI. I can get someone an X-ray. I can get someone a CT scan. And that's helped a lot when it comes to those times, you know?
Yeah.
If I think that it's necessary. But, you know, the industry's changed a lot, like I said, and I wanted to be on the forefront of that because I wanted to set a standard. I wanted people to look up to me and say, hey, you know, if I'm going to go into this physical therapy direction with my career, how can I make it so we're going back in time to where, like, you had a family physician, you had someone that was in your back pocket that you could trust and talk to all the time. And not just you, but a lot of my patients have that relationship with me. And I know that it can be overwhelming at times when patients are going through terrible situations. So, you know, not only are you dealing with the medical side of it, you're dealing with the psychological side of it as well. And so making sure I'm up to date and making sure I'm always studying, making sure I'm finding the next best thing is something that I'm always looking for. And, you know, point blank, how many times have you come to my office and then I'm doing something else, I'm doing something different. And to go back to what you originally said, it's like I practice more as a mixture of Western and Eastern if I had to explain myself to someone. And then even if you explain me to someone, sometimes my patient's like, just go to her because I don't really know what to tell you.
Yeah, sometimes I tell people about some of the things that you do in your office and they're like, that sounds terrifying. But in comparison to the physical therapy that I've been in the past, like before I met you or because of an insurance thing or whatever it is, like I have been in therapy for my neck, right? I have every disc in my neck is herniated, whatever. I'd be there for maybe 40 minutes. 10 of those minutes I'm in a massage chair, literally like the kind in the mall that you put $1 in it and you sit there when you're tired from shopping. Okay. Literally 10 minutes in the massage chair, then like 10 minutes on a traction table, which feels like I'm in the medieval times. Like you're on this table and it's just a roller rolling back and forth under your, you know, from your neck to your hips or whatever. Then it would be like the electrostim, you know, another 10 minutes. And then they'd have me do like these neck stretches for the last 10 minutes and then you're good to go. Not once like did the doctor ever touch me physically, like let me help you with this or whatever. When you go to Christiana's office, you're getting some sort of acupuncture, needling, electrode things on the needles, which is crazy. She also has this device. Wait, let me explain this. And not to scare anyone off, none of this is painful, guys, just so you're aware. You're not going to be there crying. Maybe sweating, but not crying.
A little sweaty, a little sore after, but...
Yeah. So she has this thing. I'm going to let you explain it, but let's put it in Vanny words first. Like, she stands on a grounding plate. Correct me if I'm wrong. She puts another plate under your body so that no one gets electrocuted. And then there's electricity going through this woman's body. And then she massages you with her hands while the electricity is going through her hands. Did I explain that?
It's good.
Yeah.
It's good.
Bro, it's crazy. Like, you guys, if you... Like, even if you don't have an injury, just go for the pure, like, anti-inflammatory benefits of this. It's insane.
It's amazing.
Yeah. I always feel a little sore when I leave, but
of course.
In 2 days, I'm like, she fixed me. That's it. Like, I don't need surgery anymore. I'm good to go. Like,
well, you know, like, to go off what you said, like, the typical setting that you're talking about, that's not individualized. That's the problem.
Yeah.
You know, they have not just you, but every, you know, let's say they're seeing 50 patients in that day. I'm sure all 50 of those patients are doing that same thing.
Yeah.
And that's a problem because we're not individualizing.
And they're just rotating you between the rooms.
Correct.
Like, okay, she's done with this. Now you go on it.
Right.
Now let's put this guy here and now you go here.
It's this running mill. So what I try to do is I try to individualize everyone's program, let's say, or whatever their healing protocol is going to be. Because it makes a difference. The way you heal is going to be different than the next person. What works best with your body is going to be different than others. Sometimes people can't, their body, it doesn't work well with the electricity. So it's not worth having that, you know, stimulation going through their body because they might not need more stimulation. They might need to desensitize themselves. So like that machine we'll go over in a little bit. that machine can also be used to deregulate or desensitize something. So if someone is too anxious, someone is too hypersensitive, I might have to go down to a lot lower level of a frequency and wavelength to make sure that I'm calming that tissue down. And point blank, I could do the opposite. I could, have someone in my office that maybe had a surgery, had a nerve injury or something like that. And then that caused some sort of atrophy in the muscle, or that caused some sort of weakness to occur. And now I'm trying to stimulate and facilitate the nerve to that muscle to kind of regulate it again. So there's so many things out there. And that's one of probably the most recent tools I've added into my office. But the other part of it is I don't want to see you frequently, and I don't want to see you all the time.
Well, that's the thing too, is like you give homework to people.
Correct.
Like she will see you for the hour and a half, and then you are going to get an email with everything you need to be doing until you see her again.
And that includes the app. So the app also allows my patients near and far to, let's say someone goes on vacation for a month or whatever, they're not in town. They're able to message me on there, and then I'm able to progress them. Because if they're updating me constantly, I'm able to address and progress those things.
Yeah, and that's cool too, because on the app you can put like the level of pain you felt. Correct. And how you felt. You could leave her comments on like, how that specific movement went for you or whatever. And
that goes into also, educating everyone about that physical therapy isn't just the hands-on part, and healing just isn't the hands-on part. Because if we talk about tissue levels, strengthening is probably the biggest part of healing. And I think we lose sight of that because everyone wants the fast, quick solution, which I get. I mean, I want it for a lot of things, but it doesn't necessarily work like that, and tissue never responds like that. So the strengthening part, the mobility part, the flexibility part, that is what's going to help people get ahead.
Yeah.
And that's the biggest part. Everyone thinks like, oh, I could just go in and get soft tissue work every other day and I'll be perfect, but that's not how it works. And that's just not how our bodies were made.
Yeah.
So the strengthening, the stability, the nerve integration, all the stuff that you do on your own is a big part of it as well. Yeah. And then that can go I dive deep, and this with holistic stuff when we're talking about what you're eating, nutrition, how are you sleeping, how's your mindset, how's your gut health. That's all going to play a role into how you heal as well. Because I could say, you have this back injury, it's not healing the way we want it to, it's very slow, but you're not drinking water, you're not having electrolytes, you're not sleeping, you're eating McDonald's every day. You know what I mean? That's where we see the backtrack or the slow healing, and the consistency is part of it too. But we know that with anything, whether you're trying to lose weight, whether you're trying to gain weight, whether you're trying to run a marathon, it's the consistency that gets you there. And that's probably the hardest thing for most people, is the time, the patience, and the dedication.
But honestly, like the programs that you give us are not, they don't take that long. Like it's very easy to do, like anyone can definitely incorporate that into their day or I do it in my gym routine because, Christiana hasn't really stopped me from going to the gym.
No.
She just adjusts what I have to do or whatever. But I do it before I work out. I just take my bands and whatever to the gym, and 20-30 minutes before the workout I just get it in. So like, yeah, I don't understand personally inconsistent people. Like if I cannot grasp how people want something and don't do what they have to do to get it or to feel better or whatever. Like I can't get that personally, but it's really not you're not telling people to spend 3 hours a day like rotating their knee. Like it's not that. It's definitely not that.
But and to that respect, sometimes it can be overwhelming if they have like multiple things going on, and then they can be overwhelmed with some of the stuff. But to that respect, my patients that win, my patients that do the best, it doesn't matter the severity of their injury. I've had someone who has lost a limb.
Yeah.
And I have another lady that was burned on a boating accident, bad, and she came back faster than a patient of mine that had a thumb injury. All because they just put the work in,
yeah,
and they put the consistency in. But that's why you and I are also good friends, because you and I have a fair share of our own health issues. We've had a, history, and you and I are very consistent people from the time our feet hit the floor to the time we go to bed. And it's a very hard thing for most people to, change their lifestyle. A lot of times people are also handed that down, generational wise.
People are just like addicted to food. And they're just kind of trapped in that. Like, it's funny because my dad just had his heart surgery, as you know. And now I have him on like a couple new supplements, a couple new things in his diet, whatever, took away a couple things, and he's doing it, which before he would never. Like, he was like, I take the blood pressure meds, shut up. Last night he called me and he's like, I'm freaking out. My blood pressure's too low. I'm freaking out. I'm like, well, maybe you don't need the medication anymore, like, we'll see. Talk to your doctor, whatever. But yeah, like, it makes a huge difference if you just take the time to, integrate that advice into your life. And same with my mom. My mom's down 11 pounds.
And she's been consistent for what, a month?
Yeah, not even maybe like 3 weeks. And she was somebody who before was like, I can't eat like that. I can't, like, bone broth every day. That looks disgusting. Like, what is that fat sitting on the top of the cup? I'm like, just drink it, please. Like,
scoop it.
Yeah. But now, they're both starting to listen to me, and
just by you doing that for them, like, they're going to be around a lot longer because of it.
Yeah, literally my dad was like, I'm going to give your number to some of my friends. I'm like, I can't do that. That's illegal. Like, first of all, I'm not a nutritionist. Like, calm down. I'm telling you guys because you're my parents. But no, don't give anybody my number, please.
But that might be something
I've
might integrate into your career at some point.
I've considered, for sure.
I think some of the best doctors that I've met myself personally, including myself, like, I think what's made me great over the years is because I've gone through so much. I've gone through breast cancer. Check that off the list. Gone through lupus. Still dealing with that and learning to live with that. Add it to the list. The vein stuff I got going on recently, right? Like, there's so much going on. And because I've gone through it, because I've gotten through it, it's helping me set a platform for my other patients. And that's what makes also other doctors great in this field, is that, a lot of them have had massive injuries, or maybe they've had surgeries before where they've been in those shoes. And when you can empathize with the person in front of you, the patient is going to say, okay, this person really cares. This person really understands what I'm going through. And not even from that standpoint. I mean, I used to bodybuild, right? I know what it was like to get on stage. I knew what it was like to drop my weight and not eat anything for a month, and then try to rev up and get on stage. And I'm working 2 jobs. I'm going to school. Like, I've been in those shoes. I've powerlifted. So I think it's when patients come across doctors that haven't had the experiences themselves, or they haven't had patients that they really were able to help.
Yeah.
Or they just kind of shoo-shooed them off the table. Okay, it's another payday. That's the problem. And that's why I'm so passionate about it too. And some people will tell me, like, you do too much, you're, running yourself thin.
I tell you all the time, I'm like, take a vacation, please. Get off your phone. What are you doing?
I mean, you've read my tarot cards before, so.
And I've given her tarot readings, like, you need a vacation.
I think you've drawn like 3 of the same cards, and you're like, this is more of a sign.
This is you need rest. This is you need a vacation. This is you need rest again. So, like, I'm sorry I couldn't go deeper into that, but that's what it is.
This is what it is. But to that respect, I mean, that's just why I'm so grateful for where I've gotten myself, because I think that if I'm grateful for those versions of myself, Sometimes you would get in my head and be like, oh, I'm not that person, or I'm not this person, whatever. And then I realized, man, that girl is what got me here. And that's why I am who I am. That's why I have patients that I love. I go and look at my schedule in the day and I'm like, man, I can't wait to see, Joe. I can't wait to see Vanessa. I can't wait to see this person, because I really love everyone that walks through my door.
Yeah.
And if I say,
you do have a relationship with everyone.
Every single
everybody.
No matter the age too.
Yeah.
That's what's so beautiful about it. So
yeah, guys, I've seen her work on babies up to,
I think earliest was my 3 months old.
3 months.
Yeah.
Oh, what's been the oldest?
92, I think, is my oldest.
That's crazy.
Yeah.
I think at that age I'd just be like, forget it, I'm going to sleep.
No, the best part is that, like, she's like an avid tennis player, and she amazing shape, and like the only thing she came in to complain about was her elbow. I was like, nothing else.
She plays tennis. Yeah. It's just a regular tennis injury.
That's it.
Yeah.
Like, I got some tennis elbow, and tell me what to do, and like, let me be on my way.
Yeah.
Okay. I think that again, talk about like longevity, talk about, you could have 1,001 injuries, and if you just keep your body internally healthy, externally healthy, you're gonna have that length of time, hopefully. Obviously genetics plays a role at some point, but the goal is to not have to fight against your genetics all the time.
Longevity is the name of the game, for sure.
Yeah,
that's awesome. 90 years old.
90.
My grandpa would never.
Mine is 94. My grandma is 94. God bless her. And she's still living in Queens. Same house that she raised my father in.
Yeah, why is she gonna leave?
No. She's up to date with everything, can use the phone, knows how to. She got her first speeding ticket at 91. She wasn't even going that far over. It was just so funny, but she selfied it to me because she was so excited that she got her first speeding ticket at 91. I was just like, what is it? I had to zoom in because I wasn't sure what she said.
She's like, I was doing 38 in a 35.
He pulled her over. And I think she might have told the cop, give me the ticket because
I want it.
Because I've never gotten one before.
She's going to frame it and shit.
So, yeah, I mean, I have my dad's side, we have some good longevity genes.
Yeah.
So
my family, I don't know so much about longevity genes. Everybody on my dad's side has had heart attacks or some sort of high blood pressure or heart condition. I think I'm pretty okay where I'm at now. And then my mom's side is diabetes, pancreatic cancer, stuff like that. But that's another reason why I'm so adamant about the way that I eat and train and what I ingest, even alcohol. I drink 2 drinks and I'm breaking out in hives the next day, texting you what the fuck is my elbow doing, just on fire. But yeah, to me, I don't know, it's just not worth it. But some people, they don't have that consistency, and
some people also aren't self-aware, you know what I mean? They think that having a rash after they had pizza is normal in their stomach, or being bloated all the time is normal. And they look for ibuprofen, or they look for Gas X, and they look for something like that to fix it, and that's not the case.
Or Pepsid all the time every time they eat anything.
Right. Or you go to the doctors and they'll put you on protein pump inhibitors or something. You know what I mean? And again, it's a quick fix. Yeah. It's a quick symptom solution, but that's not what's going to fix it. Right.
Yeah.
And you talk about longevity with your insides, or we talk about physical therapy wise, you keep your strength training going, you keep your mobility going, your stability going, all of that just ties in together. And muscle truly is, and a lot of people could argue it with me, but I think that muscle truly is the thing to have longevity in life. If we have muscle and you have protein, you're going to live longer. Just think about it in terms of osteoporosis, for instance. The stronger we build our muscles, the stronger the bone gets, the denser the bone gets. That means we have more stability,
less prone to breaking
bones later on in life. You're talking about the organs being strong. You're talking about the stomach being strong. All that comes together.
Do you think that it matters where people are getting their protein from, as far as plants versus animals?
I do. Again, a lot of that, if you look at science, there are so much that says, one could be the other. I don't tend to look at too many research articles anymore, honestly, which, my teachers probably in school would be like, what? Just because it's so confusing, because you can find one article in, PubMed that says, grass-fed, grass-finished beef is the best thing for building protein, building muscle size. And then someone, other article in Journal of Internal Medicine could say that this certain enzyme in a plant is what can give us, you can't get it in meat, and that's the only thing you can. So I think it also depends on the body.
Yeah.
What your body might be more prone to feeding off of. And that there's no way to really test it either. It's kind of based off the person. So, I've had patients where they've tried to do more of a carnivore based diet and it just wasn't for them. Not even just from they tried it. It wasn't like, they were afraid of meat or killing a cow or anything like that. It just didn't sit with them well.
Yeah.
And so they found that having a more plant-based diet was what, allowed them to thrive. I've known 2 bodybuilders in my career that are plant-based, and I found it amazing because they really cultivated a way to do it.
Yeah.
I am more in favor, obviously, of a more carnivore-based diet. But when you talk about like weight or weight gain, like muscle versus like fat, if you're engaging in a lot of like carnivore type diet, but you're not exercising and you're not doing the calories out, calories in, you're just eating fat. So so some people will refute like, hey, yeah, carnivore got me fat though, and I gained weight. Okay, but if you're having 20,000 calories of meat in a day, but you're not expelling that.
Yeah, but that could happen if you're just having oatmeal too. Correct. Like Correct. There has to be a balance between Correct. Especially if you want to lose weight. You have to work out. Correct.
In my eyes, we as humans are known as omnivores, right? We're meant to have plants. We're meant to also have meat. And I think there's a beneficial balance between the two of that. So when it comes to putting size on, I'm more in favor of, or muscle density, I'm more in favor, obviously, of more of a carnivore type diet, protein-based diet. Even like the protein powders, I'm more for like, I'd rather not have a pea protein. I'd rather have more of a grass-fed, grass-finished type bovine, or I don't care if it's buffalo or whatever type protein to intake. So
I just started taking one like that from True Nutrition.
Okay.
It's unflavored. I got the unflavored because it's like, I think 36 grams of protein in a scoop. It's a lot for a protein powder. Normally they're like 25. 20,
yeah.
But it tastes like, it has a meaty taste. And I only use protein powders for yogurt. And I just down that shit because I'm like, this tastes like I'm eating
I just gotta get it down.
Like yogurt meat. I'm like, just get it in. Because I'm not really like a protein shake person or like a smoothie person too much. But yeah. So I wanted to ask you a couple things. One of them being like, what are if you can, I don't know, sum it into one, what are like some of the common injuries or issues that you see a lot of athletes facing?
Does it matter what type of athlete?
No, just like, is it mostly knees? Is it mostly back? Like, do you?
So I'll just tell you, I think it might be better if we like.
Dependent on the sport, probably.
Yeah, obviously depending on the sport. I tend to work with more, at least this point in my career, I've worked with more UFC fighters, MMA athletes, boxers, NFL guys. That's my scope, bodybuilding, powerlifting. So when it comes to football, I've worked a lot with more like the defense line. And a lot of those guys deal with a lot of posterior chain issues. Obviously, right? They're trying to block back. So you're talking hamstrings, knees. I have a lot of knees, calves, Achilles, stuff like that. The knee is the craziest part when you talk about football. I could argue this, and not too many people are looking at it, but if you look at NFL injuries right now, right? And not even NFL, NBA is even having it too. These guys are just running down the court or they're running down the field and all of a sudden their knee blows out for no reason.
It makes me throw up a little bit.
Right. Right. No reason. They're by themselves. It wasn't a contact injury, nothing. Nobody hit them, nothing. What I think is happening, and this is something I want to bring through, because there are people out here starting to make cleats that are more fitted for a foot. If you look at like NFL cleats, if you look at basketball shoes, they are not meant. I feel like there's a lot of stuff when it comes to why these are happening. So like I said, the shoe wear is one of them. I think the cleats, I think Nike is a big, I think they are the cleats for the NFL. I feel like those guys need to start making more wider toe box shoes for the guys to put cleats in. And I think the turf is also a big part of it as well. The turf is where you see a lot of injuries. It's not like the actual grass. And you can ask these guys, they do not like playing on turf. Yeah. Also, because when you fall, like you get the burn, it's like a rug burn.
It's like plastic you're falling on.
Yeah, and it hurts. It's really uncomfortable. And the other part of that is the overtraining that we're seeing. And you know what's crazy is down here in Florida, I'll go into baseball a little bit more here. I'm going to just like dive into this, but I'm from New York, so we had seasons, right? Football was fall into a little bit of winter, summer kind of, obviously preseason. And then baseball was spring, obviously into summer. But they weren't playing all year round.
No.
Now you got these kids down here, let's say some baseball athletes that I have, right? They're playing all year round. And then you want to know why they have chronic elbow pain. You want to know why they have chronic shoulder pain. The kid's pitching over 90 miles an hour as a high school athlete. I was going
to say at like 18 years old.
And he's playing all year round. I mean, at some point, the body's going to give.
Yeah.
But they put such a demand on these guys. If you want to make it, you gotta hustle, you gotta grind, you gotta be on front. So, down here, especially with baseball, I see a lot of that. Because it's all year round. They've got to play in the summer. They got to prove to colleges that they're going to be the best of the best.
Yeah.
So I see a lot of that. I would say fighters, I see a lot of shoulders, a lot of elbows, a lot of knees, hips. The hips more so with the MMA community, but you'll see it sometimes with boxers. And then obviously UFC is just pick it.
Yeah.
What did they come out of the fight with? You know what I mean? Sometimes I get guys that have like these like contusions on their shins and the bone's almost sticking out of their shin, and they're like, hey doc, I'm like, my neck's a little tweaked. And I'm like,
what about your leg?
What do you want to which one do you want to focus on, man?
You're just looking at their shit like, are you sure?
Right, because like from a doctor perspective, we got to work on the most serious thing and care about the rest later. But that's what I see
They're
most
like,
of.
I feel a little twinge.
Little twinge here. Can we'll focus on that? Don't worry about the shin. The shin will, it'll be okay.
Heal, yeah.
My broken toe, it's all right. I'll just buddy tape it, But these guys are truly amazing. I mean, just to put your body through what they're putting their body through, and that's not even a full, consider a full career, but some of these guys don't even get to finish their career.
Yeah.
Unfortunately. I have an old patient of mine. His name's Ken Farrow. He was with the Dolphins, and he actually, I had a little podcast I did on YouTube like a while ago. I stopped. I didn't really have the time to do it, but him and I talked about it. And what was crazy is that he had this accident, and he talks about how, and this was like kind of when I met him, that they were telling him, oh, you have a labral injury in your shoulder. You have a labral injury in your shoulder. And this is like at a pro level, right? I don't think he was with Miami at the time. I can't remember if he was with the Chargers or not, but he ended up having a shoulder blade fracture. So they're treating him for this, and they're pushing him and he's like, yeah, I'm hurting, man. Like, I'm hurting. So it's crazy.
You never got
see
an MRI or anything?
Not till like he pushed for it. Not till like other people in his team pushed for it. But like a lot of these guys have to go out of the team to get help.
Yeah.
And that's me for a lot of guys too.
It's kind of sad too, because when you're, at least from my perspective, when you're an athlete, you are, I don't want to say like dance monkey dance, but you're an entertainer as well as, being an athlete.
Yeah, you got these contracts and they have to abide by the contract.
You have to do it. Like, oh, you're hurt. Well, your sponsor needs this and this and this from you today, so you're going to have to suck it up.
Correct. And it's pretty amazing what he's doing. He's out of Houston in Texas, and he actually they got funding, I think, from the steel workers, steel miners, and they're helping these guys that are coming out of mainly NFL careers that had short-term careers because of injuries or whatever it was. And they're helping these guys find careers again, and they're helping find a path after the NFL, which is amazing. Like, nobody did that, but he went through it, and he was like, I don't want other guys going through it. He got me on a call with one of the guys from the Chargers, who was a good friend, and neck injury, and they were like, hey man, this is the money we're gonna give you to retire, and that's it, man. That's it. You're not worth our time. Because if you're not the Tom Brady's of the NFL, it's tough, man. It's tough
for all athletes. Like, how many fighters do we personally know that have been fighting their entire life and are still struggling because
and holding on to it?
Yeah. And still wanting to perform the best they can, and they're still not where they should be with the time that they've put in, and even with the talent that they have. Like, because you have to be talented to fight. You have to be talented to be in the NFL. Like, hello. Yeah. But
yeah, it's definitely something that I feel like a lot of people talk about, and I think they're starting to move in a more positive direction. But I feel like more needs to be brought to the surface. You know, the NFL, they have a good amount of money. The NBA has got a good amount of money. But when you talk about when those guys are done, then what? What are you left with? And some of these guys aren't even get the financial support. You know, if they don't have like the right family that maybe, or friends that guide them into, hey, this is where you should put your money to let it grow. This is how you're going to put your money here so you can, you know, retire and then have yourself set up for life or your family. You know, some guys don't have that.
And some of them make that much money when they're so young.
Yes.
And what do we do when we're young and we
blow
have
it
money?
Right.
So,
right.
Yeah.
So yeah, I mean, it's a little bit more sad to see, or it rips at my heartstrings, honestly, when it comes to the more of the fighting community. Because if you're not the Ryan Garcias, if you're not the, you know, Tank Davis, you know, of the boxing community, Tyson Fury, that you're not making much. And I know Maureen will definitely talk on many different platforms about that, but especially for women. But yeah, it's something that I think really needs to be paid more attention to with these guys. Yeah. And again, like you said, it's more of an entertainment thing. And you could have one bad injury and it just, didn't catch the hand right, or, you know, something happened on the field and that's it. So
do you think that athletes, young or older or whatever, doesn't matter the age, do you think that athletes should be getting some sort of physical therapy, let's say once a month, twice a month, as preventative? Or do you think, like, as long as they're doing their whatever stretches and stuff, that they might be okay?
Yeah, I mean, I think so. I think that my athletes, even the youngest ones that haven't made it to college yet or haven't gone to the pro level yet, I mean, I wish that was like accessible to me when I was an athlete, because I probably wouldn't have stopped running. You know, not many people know that I used to be a long distance runner and I was a good one. You know, I'm a meatball, but, you know, I was a really good long distance runner, oddly enough. People be like, what?
I used to run track.
Yeah, it was pretty good, man. And, you know, unfortunately, injuries happen. You know, strength and conditioning wasn't really where it is now, which is cool to see now where it's at. And it's a priority for these guys. That wasn't a thing really when we were growing up. So, and if you weren't, again, in like a class A school that had the funding for that,
went to practice.
You're just like, even so, I think they threw us in the weight room for 30 minutes and like, all right, go ahead. And I was just like, you know, on the bench doing whatever. You know, it wasn't anything guided. So, you know, from that respect, I think it's amazing that some parents have gotten their kids into my office. I mean, can you imagine, not just me, but any other, like, you know, one-on-one physical therapist, like, you get these guys in your room at age 16 or 17 and you're teaching them to set the standard for themselves. I have kids that come back from college now and they're like, Doc, it's not the same. And I'm like, I love you, but I know I'm your favorite, but like, I know when you're out there, you can't, you know?
Yeah.
And they're like, I'm like, don't, you know, some of these kids are so funny. They're different generation now. You know, they'll be like, yeah, but my therapist doesn't do that like that. And they're like, well, this is what we have.
Yeah.
I'm like, don't.
They're like,
I'm
posting this on TikTok because this is wrong.
They're like, this isn't the way. These are not glass cup. I'm like, okay, listen, bougie. You know.
They use the plastic
they hate it. It's so funny. So you
could get those like on Amazon and just like
correct.
do them yourself.
And that's what they say. They're like, it doesn't work. So they'll tell the athletic trainer, I'm not doing that. And I'm like, oh my god.
I'll wait till I go back to Florida.
Yeah, I'll wait till I go back home. But I love them to death. But, you know, even at the NFL level, right? Like my NFL guys, man, they're in consistently during the season and even during OTAs. And then I have guys that are now, you know, coming in because they're having to heal things when they have the downtime in between OTAs and then when the season starts. So I think it's super beneficial for athletes, but not even just athletes. Like, let me go back to what you said about the general pop. Like, I think if you have this certain like level of tissue plasticity and relaxation of tissue and stimulation of tissue. Because regardless, I could pull anyone off the street and I'm going to find something wrong with them.
Yeah.
Wrong. You know what I mean? Or I'm going to find something that's tight. You know, a lot of patients love to ask me, hey, does everyone have knots like me? I'm like, yes. Myself included.
We're all hunched over. We're all stressed.
We all have, you know, we all have our things in our anatomy, quirks and stuff. So, you know, trauma, depression, restless nights, babies, whatever it is, you know, we all tend to have those issues. So it's.
Well, I wanted to ask you that too. Like, how do you tailor the approach if it's different for therapy for athletes or just general?
It's really not that different. I think everyone thinks like, oh, I'm going to get the athlete special. I'm like, it's not, you know, it's depending on what you have coming in. You know, if I see that you have deep rotator issues in your hip, it's not going to be much different than what maybe, let's say you came in and got, or let's say I have a 75-year-old man who's got a tight, you know, external rotator of his hip. I'm going to treat that very similarly. It's the exercising, it's the strength training, it's the mobility stuff that's where things are going to be very different.
Yeah.
You know?
And another thing I wanted to mention to the viewers and listeners is that at Dr. Marron's office, yes, you walk in and you get, you know, stabbed and needled and all of that stuff, but also she has like a gym in her office. Like she has a squat rack in there, there's plates in there. Like if one of our friends, Maureen Shea, you guys know her, episode 3, I believe, maybe 3. Like if Maureen's getting worked on, I'll go and do my rehab stuff like there, just like talking shit with them. But yeah, she has a gym in there. Like if you need help with something, she will tell you, hey, you're doing this wrong. Like the first time, I think it was the second time that I was doing my hip rehab stuff. Was when I did it there. And I was like, am I doing this right? Is this supposed to be like this? You know, it's funny because I went to the gym with a friend of mine the other day. He doesn't really have any like injuries that I know of or whatever. But I'm like, I have to do my hip stuff first. And I was just doing it. He's like, I'll do it with you. And he's just doing it. I'm like, dude, you're like actually pretty flexible. Like he was doing that quad one. Oh, like that you have to turn your
pretzel.
Listen, it hurts. And he was doing it like no issue. And I'm like, do your hips hurt? He's like, no, I'm just going to join you here stretching. I'm like, all right.
I'll warm it up.
Yeah. He's like, how do you know all this? I'm like, my doc, she's the best.
You're so funny.
She teaches me everything.
But I mean, you know, that's where the movement, the flow, the strengthening, the stability, I mean, it all just plays a role. If someone just moved every day, and here's the other thing that I think that everyone gets so...
It's so funny because you're saying things that are like my next question. Like, yeah.
Revved up about like, what is the perfect exercise for this? Or what is the perfect... It's really about where is the injury in the stage? You know, if you have something very acute, let's say you just strain your hamstring, okay? I'm not going to have you stretch your hamstring when you first strain it. Why? Because you already pulled it. So those fibers have been ripped apart.
And it hurts.
But that's people's like inkling is like, oh, it was just too tight. I need to stretch it. But if you're stretching something that's already separated, you don't want that. You want to bring that back together. So then people get really confused when I'm like, oh, we're going to move that thing. And they're like, wait, what? I'm like, no, you need to move it. And they're like, no. And I'm like, yeah, we're moving it.
This woman popped my hip back into place like 3 weeks ago. She's like, all right, lay here, do this. Whatever. I'm going to pop your hip back. I'm like, what are you going to do? You're going to what?
No.
Pop. Okay. I'm here thinking like, she's not even going to barely touch it because I'm in pain. Like, no. Snapped it right back in. And I'm like, can I do legs now?
We're going to work up to it.
I know.
That was like this kid's elbow I had. I mean, his elbow was like subluxed and he came in. He couldn't like move his elbow. He couldn't extend it. And I was like, all right, let me just see what the motion is, you know. And then he just, pow. And he was like, ah. And I was like, all right, straighten it. And he was like, okay, I can straighten it. And I was like, all right, go back in there. But, you know, it's just... it's really there's no perfect exercise. It's really about where you are in the stage. Let's just say healing, for instance, where you are in the stage of the healing process. volume, intensity, rep range, that all plays a role. And then obviously the proper progression of it. You could take something as simple as a glute bridge and you could bring it down to the most basic function if the bridge is way too tough for someone, and then I can make it into the most complicated exercise in the world if I wanted to. So it's really about proper progression, where that person is in their healing phase, and how am I going to get them to that goal. If your goal is to just be in the gym and be train more like a bodybuilder, that's your goal. If you're telling me you want to run a marathon, well, our training progression is going to look a little bit different. So it's really based on that. Now, obviously, some coaches, some trainers have, and physical therapists have, I guess I would say, more things that they like more so than other things, right? And then they might believe that this is the best way for this person or vice versa. Exercise selection, there's so much.
Yeah.
So it's really not like what is the best. It's really about that person. Again, going back to the individuality of like physical therapy or strength training or coaching. You can't just give someone a cookie cutter plan. You can't give just someone a cookie cutter diet. You can't give someone a cookie cutter strength and conditioning program because it's just not going to help them win.
Yeah. How do you like with all the new technology and all the new research or whatever you want to call it, how do you stay up to date with all the latest things in physical therapy? And also, how do you choose the modalities, I guess they're called, that you're going to use in your practice?
So point blank, I'll talk to you about that machine you were talking about earlier in the podcast, which is the electricity through my hands.
Like, how did you decide, like, I'm going to start doing this?
So oddly enough, there's this massage therapist out of California. His name's Mickey, and his techniques are just, I love the guy. And there's not many people that I really, truly appreciate. And he's just one of them. And he's so sweet. He's so caring. He shares a lot of information. And just something about him, I knew that he knew his stuff, and I knew that he worked like I did. He had the same mentality, and he wasn't ego driven like a lot of what you see out in the social media world nowadays. And, I connected with him, and I saw that he was doing this Electrons Plus machine. So sometimes it can be as simple as social media. It can be as simple as me reading journals. I read a lot of, I get journals from being a part of the APTA Association. And so I keep up with like more sports literature. I keep up with more like musculoskeletal disorders, orthopedic, because that's just what I work best in. But then it's also about the patients. So sometimes I have patients come in and they have some crazy cases. And I know I'm smart, but I'm not the best at knowing every single thing. So if someone comes in with a neurological disorder and it's just something I haven't really touched upon, I'm going to be honest and I'm going to say, hey, look, I know about this much I can start helping you with, but I got to look in a little bit deeper and see what this is about, because it's maybe a rare thing that you don't really necessarily see all the time or you don't treat all the time. So I've actually learned more so from my patients because they've come in with certain things and I'm like, boom. And that's helped me for the next person. That's helped me for the next person. And then, I get a person that comes in with a case and I'm like, how do you even know about this? Because it took like 10 doctors to even like understand this. And I was like, well, I had someone that had this and this is what we found. So, and even go back to the machine, for instance, like that was like one of the newer things. And, there's so many things out there. There's Shockwave, there's this stuff, there's, everyone's doing this or whatever. I knew the things when I came out of school, what I wanted to start getting certified in, which was like Graston. I knew I wanted to do the dry needling, but dry needling didn't get legalized in Florida in general until 2020. So I was learning how to do it by an acupuncturist, but technically acupuncture. But then when I learned about the dry needling and they legalized it, then I jumped on getting accredited because you see how much it helps certain patients. I'm not trying to sell someone.
Can you explain to everyone what's the difference between acupuncture and
dry? Yeah, sure. So when we learned dry needling, we learned all the acupuncture points. And acupuncturists, they work along something called, they look a lot at like the tongue, they look at your pulse, they look at meridians in the body, because in Eastern medicine, they believe that our bodies have these meridians and that our organs are kind of placed on the outside of our body. And sometimes we could be more wet and we have more of a wet environment. We might have a more dry environment, and they're trying to balance out that energy. So if you're too wet, they want to bring more dry to you. If you're too dry, they want to bring more wet to you. They also want to look at if you're having pain along whatever path or meridian it is, where is it being blocked? And there's a big word there. They believe in chi, but it's QI. So they believe that if that energy is blocked, that chi is blocked.
Is it similar to like chakras? Like how people say like, oh, your sacral chakra's blocked, or
kind of, yeah. It's like, so energy can't flow. But from a physiological standpoint, blood flow isn't flowing. So on my end, that's why I say I look at things a lot from an Eastern and Western perspective, because I say, okay, an acupuncturist is going to say to me, well, along their bladder channel, which is along the paraspinals in your back, right? They say it's the bladder channel. I'm saying paraspinals.
Okay.
I'm looking at it more from that physical mechanical modality, saying I know what they're saying. That's the bladder channel line. I'm saying that's the paraspinal muscles. I'm saying, hey, they have some tension in these paraspinal muscles. They're saying their energy is blocked in that meridian. And if they want to get rid of their back pain, that they need to work alongside the bladder line.
Got it.
So they're trying to open up those energy pathways to find and restore balance. Now, for me, from the dry needling perspective, let's say it's like rotator cuff. I'm going to go right to say, okay, supraspinatus tendonitis at the musculotendinous junction. That's where the muscle meets the tendon. I am going to take that needle and I'm going to go right into that spot. And then I'm going to stimulate bleeding into that area to allow then the whole ATP drop, the healing aspect, the adenosine drop, the calcium. I can go into that whole thing, but that's when we see like the actual cellular healing occur. And
you could literally feel it. Like,
yeah, it's crazy. It's very crazy. And I've done it in my hip because I have 2 labral tears in my hip. And I remember the first time I had it in class, I couldn't wait to get it done because I really wanted to see like how it actually felt myself. So I could be like, okay, is this real shit or is it bullshit or whatever, you know? And I said, okay, I have a labral tear. Can we do it in my hip? Yeah. So for 2 years, I could not get into like a pigeon stretch. I couldn't get into, cross my leg over my other leg because it would just hurt so much in the front of my pelvis.
Yeah.
And then afterwards, and since then, no issue. Right afterwards, I was like, wow.
Yeah.
That really, it was uncomfortable, but it felt like a good discomfort. It's a release.
Yeah.
And
so she said bringing blood there, you're not going to bleed if you go see her and she does try needle. You're not going to be like dripping blood out of these spots. Like Correct. She means internally.
But it is such a, we went to these classes and we had to learn all the, physiology that occurs at that point. And I could bore everyone to death on that here. But there's such a physiological change that occurs just when that needle goes through and into whatever area of concern you're working on. And
you literally feel it because I've gone to you before. You've needled my entire body at this point.
Pretty much.
Like my toes and everything.
Your neck.
In my neck, like everywhere. And there's been times where I always have tight hips for whatever reason. And she'll tell me, okay, yeah, this hip's tight. I'm going to needle it, right? And as soon as she puts it, it feels a little nauseating. I'm not going to lie. It's like a feeling, and then it just goes away. It's a split second. But immediately after, like, you can see even the movement is so much different in my hip, than prior to the needle. Like, it's just crazy.
The cool thing with that, too, you're talking about the other aspect of dry needling, which is, like, trigger point release.
Yeah.
So trigger point release is a little different. You're not leaving them in. Right. So if I find a knot, or we'll talk about what a knot is, right? So let's say I feel like Vanessa is restricted in hip external rotation. I try and take her hip in the external and it's just not going. So I'm going to say, okay, I'm going to release the muscles that restrict her external rotation of her hip. So I'm going to go in there. I poke. You feel it. It pops, right? Yeah. And it's not like popping the muscle.
It feels like a bloop.
Yes.
Like that's the feeling. Bloop.
But I love it as a practitioner because it's like popping pimples.
Can you feel it in your fingers?
Yes. So and you can see it too. So sometimes you can see the whole thing like make a divot, and like you can feel like the muscle like clamps onto the needle, and then you push it again and it deflates.
Yeah.
It's like, to me, it's like popping pimples. It's like very like, I love it. It's so weird. I'm so weird sometimes.
I like popping pimples though, so I get it. I used to pierce people, so I understand stabbing people.
It's like this, whatever, fascination of helping someone. But yeah, so, in that aspect, what a knot really is when you look at the muscle tissue. If you chop, let's say your bicep muscle, if you chop the muscle in half, you're going to see like you have all these like rods and they're muscle fibers. Now, when we contract, we don't contract all the fibers because otherwise we'd be stuck like this. So you contract however much is needed or necessary to pick up whatever load you're asking it to pick up. And the speed is also a point of it too. So you might only grab maybe 14 of those fibers or something like that. I don't know. Let's say you're picking up your coffee cup.
Yeah.
Now, what can happen is if other mechanics around that joint aren't, let's say your shoulder's tight, let's say your pec's tight, let's say subscap's tight. Okay, now all of a sudden I have this knot that's occurred because I'm having some sort of compensation go on for the lack of mobility or whatever it is that's going on, or weakness. Now I have a muscle knot, which is one of those fibers contracted and never went back to its relaxation state. So when you're going in with that needle, technically what you're doing is you're hitting the nervous system, because what keeps it in a knot is your nervous system. It's a higher stimulation of the nerve that's controlling it. You're shutting that signal down, and now all of a sudden it can go back into that relaxed state, which is why when I needle your hip, like at first, like I can't get your hip past 45 degrees. I release the tension in that tissue, and then all of a sudden your hip goes boop, and it falls back down.
What do you think is, like, if people have knots in places they can reach, right? Normally, you know, people have knots in their shoulders
Traps.
and stuff like that, their traps. How do people, what is the best way that they can release these knots at home, like, before they can go see you? If they just, I mean, I feel I have a knot right now. Like, what is the best thing I can do for...
It's kind of hard because, like, you know, obviously you could go for a massage and
what do you
someone
think
could
of
do...
those sticks that are like...
I love those things. I think they're great.
I love it too. I have one.
You know, but I do think that with knots, it's more like you want to do something like a muscle energy technique, or something where like an ART, which is like, if you have the knot, you push into the knot, and then let's say it's a trap muscle, you know, then you're stretching away from it. So you're trying to like pin it down and allow the other tissue to stretch, so you can kind of get rid of it that way, and not just like digging in there, because that's when people...
I also, when I use that cane stick, whatever it's called, like if I have it on a knot, naturally I want to like, and it feels like you're like,
you want to do that,
feel it.
right?
Yeah.
That's a natural instinct.
Yeah.
And that's where like patients are like, am I doing that right? I'm like, yeah, do it. If that feels like it gives you that relief or that release of tension, do it.
Yeah, because I never really like rub it. I just pull it, and then I'm like, okay.
Yeah, because a lot of times just the rubbing is not really doing anything.
Yeah.
And it's just like you kind of go back and forth, and then you're irritated, and then it just kind of like stays there.
What I really like doing for my back and my shoulders is getting the little lacrosse ball and going in the sauna. And in the sauna, I'm just like, oh, like whatever. Everyone's like, what the fuck is this bitch doing? I'm like, mind your business.
Yeah, it's all about motion.
It's so nice.
Yeah.
Yeah, you just like squat along the wall with that ball in your
just
back
do
of your
it.
shoulder.
Yeah.
It's the best.
But then there's other, like, obviously you talk about science, there's way more than like just a knot release that you're getting. You're getting like your parasympathetic nervous system to relax. You're getting some sort of like oxytocin, dopamine release. Same thing with the needles. The other thing with the needles is it drops your blood pressure. You talk about that nauseation feeling that you get sometimes when I needle you. It drops your blood pressure. Because it's such a like it's a very nerve decompression.
We should like test it on me next time. Like I'll take a little blood pressure
yeah, we could do that.
We'll do it right before and right after.
Yep.
And see.
You'll see. And then it's funny. Like I had a girl wear I think it was her Oura ring or her Whoop or something in for a session, and I was grasping her legs, and she was like screaming because she was training for a marathon, and she was like, I think I burned more calories in this session than I did.
I leave your table damp.
I know.
Damn. Like when you worked on my Achilles, guys, I had my surgery way before I met Christiana, but sometimes it still acts up, it gets tight or whatever.
You got some scar tissue in there.
Yeah. I make it a point to see this woman once or twice a month, whether or not that was the first time that you made me like yell, that I was like, what the fuck is going on? Like, oh my god. But that's an old ass injury. Like I'm sure that's all like,
yeah, you got that like little nodule.
Yeah, I always have like a bump if I wear heels too long.
It gets like
if I'm flat footed too long, also gets swollen. Like it's a pain in the ass. But
Yeah, and that's what stings too about like improper healing after an injury too. You know, obviously our way our bodies, you know, respond to certain things or certain stressors and stuff. Everyone's different, you know, but if sometimes people are like, they're like, your orthopedic surgeon's like, hey, go to physical therapy. And they're like, no, fuck that.
Yeah. And that's also going back to what we were saying about the quality of physical therapy that you're getting. Because when I had my surgery, I was in my 20s and I was not in the gym at all. I wasn't even working out at that time. Like, I actually hated the gym. I would hear my dad and my brother talk about it. I'm like, can you guys shut up already? You're so fucking annoying. Like, meatheads, just shut up. And it was because of that injury that I started training. And when they told me after surgery, okay, in 4 weeks you're going to do therapy, whatever, I went to this therapy place, paying out of pocket, crazy expensive. I had to go 3 times a week, I think, at first, or something like that, 2 or 3 times a week. They literally just had me on a bike. And then I remember one of the days the lady had me with a walker, just walk as much as I could, okay? Then she had me, I mean, they had me do some stuff that felt like it was helpful. Like I had to pick up marbles with my toes and stuff and like put them in a bowl. I felt so dumb just being there. And after maybe 5 times of going, I was like, I'm going to the gym. If all they're going to do is sit me on a bike, I'm going to go to a gym for $30 a month and sit on a bike. And that's how I started training. Like, eventually my brother was like, bro, let's just work out. And I'm like, okay. And I remember, like, the first exercise I tried was leg pressing without any weight, just to, like, stretch my ankle. And after that, I became a fucking meathead gym rat.
Yes, it turned on. Mm-hmm. But, you know, again, that's a lot of it is about what you do on a consistent basis. You know, you intuitively already knew that.
Yeah.
You know?
Yeah.
But
I wasn't even into health or anything. And I was just like, this doesn't even feel like it's helping. Right. And I have to pay for this. Like, right. No.
At point blank, I have a guy that tore both of his Achilles. Separate times. Separate times and like separate locations. So one of it was like at his insertion. So they repaired it. And the other one was midway through the Achilles. And so it was a different surgery. But the problem between the two of them was different rehab. So his first one with the insertional tear, he recovered amazing. Has had no issues on that side. One was, I think, basketball. Another one was some freak accident where he was like jumping in the pool on vacation. And like, I think there's the other thing. Like, I think people are prone to certain things. Like he has very long tendons. I think he just never really did a lot of loading on them. So there was no like strength component to it either. But point blank, like, so the first therapy place he went to, they did a lot of soft tissue in the beginning. And with an Achilles tendon tear, you want it because it's such thick tissue there. You want to try and get those fiber orientations nice and linear. When you don't, that's when you get that little nodule, you get that little scar tissue bump that a lot of these people have who didn't get that proper treatment out of the hole. Yeah. And his other one, they never touched it. And he would ask and they would just be like, no, you don't need it. But he has had so many issues on that side since, and it flares up and it gets really swollen. And he's torn like his peroneal brevis tendon on that side just from like over walking or walking in his flip flops for too long at the beach or something. So
yeah, that's another like, trigger for me. Walking on the sand.
Involved. Yeah. There's so much involved with it.
Yeah.
And again, if you're not getting that right after surgery or right away, it becomes a problem. Becomes a problem.
Yeah.
So
and mine wasn't even like an athletic thing, it wasn't. You know, I've seen people tear their Achilles like jumping on a trampoline. Mine like got cut.
Yeah,
clean.
Yours was actually severed.
It was severed. I don't know how I didn't fucking pass out for that.
Oh, it was severed.
Oh my god. How do you work with members of an athlete's or another person's healthcare team if you do? Do you work with their coaches, their trainers?
Yeah, that's a big part of the job too. You know, you work with a lot of people. I work with a lot of orthopedic surgeons. I've worked with a lot of coaches, a lot of trainers, nutritionists. I've worked with speech pathology. I've worked with psychologists. I've worked with a lot. And
have you ever worked with a nutritionist that doesn't like agree with like the way that we eat, let's just say? Or
yeah. Sometimes you have that honest conversation with the patient and you're like, listen, what is it that you feel comfortable doing. Like, do you want to pay all this money to pay on like for all these supplements, or do you want to try and get most of it through food and then take a little bit of supplementation and see how you feel first?
Yeah.
And a lot of times I just want them to be honest with me. What is going to be the most feasible for you to do? If she's suggesting this, we could do it this way that she's saying, or we could do it this way. And it's not to overstep them or, you know, understep them. But at some point, you know, they are just going to say, well, I'm just going to do whatever the hell I want.
Yeah.
But we're not getting in the right direction. So if she thinks you're taking all these supplements and you're not really taking them, you got to be honest with them.
Yeah. Everyone has to be on the same page.
It's hard. Though I would say the one thing, and most people I don't hit heads with. Most people the doctors really are like, hey, look, you're with this person way more than I am. You know more about their life and your life and their lifestyle than I do. So if you're saying that, cool. If you're asking me for my opinion on this is what I believe. If you're good with that, we're good with it. And that's it. Yeah. You know, I have orthopedic surgeons I send my patients to, and I'm like, hey man, I think he has a cyst in the back of his knee. And he's like, I don't really think so, but let's do the MRI and let's see. And then he's like, well, you were right again. So like, you know, I love that because it gives them more trust in me as the therapist. So like now as it's gone on in these relationships I've built with these, you know, surgeons, they're like, whatever she says,
they
just
take
do.
your word.
Yeah. So it's nice when you build that trust in that relationship. There are some coaches out there that they think that you're trying to overstep what you're having the athlete do. And it's like, I'm not trying to tell them how to train. I'm not trying to tell them how to do that.
Yeah.
It's completely separate. I'm trying to bridge that gap between rehab and strength and conditioning, what you do. Most coaches are amazing. They're like, tell me what to do with them.
Yeah.
What do you want me to do? And then sometimes I'm like, hey, look, if you feel, because you're with them more often than I am.
Well, also, most coaches aren't doctors. So it's like,
yes, but
I would listen to you if I was a coach.
Right, but a lot of people are, you know, it's just like an ego industry type thing, and it's something that's like one of the things I don't like about social media is like, you could be like, oh, I have all these followers and but I'm better. It's like, you know, stop with the dick measuring contest. Like, you know what I mean?
Yeah, but honestly, like you have fucking killed it without social media.
Yes.
Like you don't need.
No, not at all.
It helps.
A lot of my patients even aren't from social media.
Yeah.
So, you know, it's that. But like I said, most coaches, most team members are really cohesive because it's not about me. It's not about the surgeon. It's not about the nutritionist. It's not about the coach. It's about the athlete, or it's about the person in front of you.
Yeah.
And if you guys all can't get on that page, then those team members are not worth being on the team. I did this school event back in graduate school, and I was really, really happy to be on it. So me and my buddy Eric were selected out of the class to be on a panel. This guy, they were giving us this case. He was an amputee patient. He was a retired vet, and he had a severe case. And they put a whole team of student doctors, people in the medical program together to help work on his case. So we had 2 people from speech. We had 2 people from, because it was a bombing accident. 2 from PT, 2 from OT, 2 from nutrition, 2 from ODO, surgical program, whatever. We had a big staff of people, and we all had to get on the same page of what we were going to do for this person. And yes, you're going to hit heads with people, and yes, there's going to be overlap in some areas, but that just helped me more so when I got out to say, hey, look, it's about the person in front of you. You got to leave that ego out the door. Sometimes we're right, sometimes we're wrong. You have to be willing as a coach, as a trainer, as a nutritionist to say, hey, look, this is where I don't know and I need help and I need to seek after. Or, hey, look, I know this is going to be the best thing intuitively for that person.
You have to think about the well-being of your patient, your athlete, whatever. Right. It's not about,
Yeah. Sure. I talked about this with one of my other athletes, this guy, Keith. He's a fighter, MMA athlete, and he had a crazy knee injury. And, you know, at that point, it was about finances and his knee. So if he took the fight, he needed the fight for the money, right? And sometimes I'm in these cases with people. And you have the person in front of you asking you, hey, doc, should I take this fight right now? And I always say to them, do you need this fight? Is this going to mean that you're on the street? Is this going to mean that you can't pay for therapy? Is this going to mean that you can't eat, put food in your dog's mouth, whatever it is? No. Then pull from the fight. Because it's not worth it.
Yeah.
If I think that they can get through it, if they're going to say to me, I need this fight to fight, what am I going to say? I can't.
Yeah.
You know? You can't pull them back. If they're going to fight, they're going to fight.
Yeah.
So sometimes it's a hard call to make, but they're going to look at you and say, hey, well, and I'm going to say, look, I would not be fighting on this right now. I'd rather save your career for a fight where you're 100% ready to dive into that.
Yeah. I mean, risking making something worse and then,
and then that's your whole career.
Possibly needing surgery or
Right.
Or
more PT, more surgery, more money, more all this.
More time off from fighting or whatever it is. Yeah. Can you share with us some tips for maintaining like overall health, overall wellness, just for the general population?
Yeah. Speaking of water, hydration is very, very important for all functioning. Our body is pretty much 70% water. Our brain too. So like if you're prone to migraines, you're prone to headaches, water, hydration, beautiful. I think that means the balance of electrolytes, right? So you're talking your sodium, potassium, and magnesium. Magnesium is another big one that I think a lot of people forget. We're really coming out now when it comes to the social media about magnesium and stuff too. So obviously those are your key components there. But water is massive. And in general, just staying away from, it's not so much like, oh, you have to have, this, or you got to go with this. I think the best thing is eliminating crap. Yeah. Eliminating the stuff that we don't necessarily need in our diet. Which is the processed sugar, the grains, the wheats, the stuff like that. That stuff we can really start to pull off. If you pull that out, you're going to have a much better balanced lifestyle, balanced diet. You're going to feel less inflamed. You're going to feel less, irritable. You might have less headaches, less frequent, rashes or bloating or symptoms and stuff like that. So I think that's a big part of it, taking out the candy, the chocolate, the stuff like that. Cacao's great. Cacao's a great alternative for chocolate. Yeah. So and another thing is like when it comes to sugars, like everyone's like, what? I love my coffee. Okay. So put honey, put some raw local honey in it and you'll be great. Yeah. Raw local honey is also really good for people who have allergies. So if you live in a certain area and you're very prone to allergies, try to get raw local honey because it's kind of like having that little bit of allergy in it and it's a small microdosing. So you actually become you build up a immune tolerance to it. Yeah.
That's actually makes sense.
Yeah.
What do you think is the best way for people to get electrolytes in? Do you think that they need to get like an element type of thing? Or?
Well, the element's good. I mean, I use it when I need to use it, but a lot of it, like, again, you could use it from regular like Celtic salt and stuff like that. Yeah. The magnesium, obviously, it's hard to get through certain things. You could have a certain amount of foods with it, but taking a magnesium supplement is okay. Depends on what you're looking for. If you want like a citrate.
I don't think a lot of people know that there's different types of magnesium and they help with different things. Some are for your heart, some are for sleep, some are for your brain. So it's like just do your research, right?
Correct. Yeah. And it's as simple like citrate is one of the ones that like you could use for a bunch of different processes, but glycinate's like the typical one that I would recommend for most patients. It's the most bioavailable anyway. So that would be one for that way. Now, when it comes to, other things, like we talk about dairy, I'm a big fan of the raw dairy, and you know that. I'm there every Sunday. Just picked up Vanessa some milk too when I went before I came here. Yep. I was very adamant about looking good for you guys, so I was trying not to sweat at the farm, and that was a big debacle before coming here. But anyway, dairy is huge, and the raw dairy is becoming a big thing now, and it's really cool to see it gaining publicity more because our local markets are actually doing really good and selling out. And it's just awesome to see it go to fruition for these guys. But there's such a difference. I mean, I grew up, I was like that kid that always had milk. My mom would drop me off at like my aunt's house and my aunt would be like, why are you leaving her with 6 bottles of milk? Like, because I would drink it.
I drank a lot of milk too.
And I was a weird kid. Like, man, I would run like a 3-mile like race and track, and I would like want to come home and like chug milk from the fridge.
You know, my thing when I was a kid was tomatoes. Like, I don't eat tomatoes now, but when I was a kid, I would have a tomato and a salt shaker and be like this watching TV, and I would eat tomatoes and olives all
That's
day.
my favorite. That, and I love onions too, man.
Yeah,
onions are my favorite.
I like pickled red onions a lot.
But yeah, olives are my jam. My mom grew tomatoes in the garden all the time, so we literally would slice them up with salt and just so delicious. Yeah, in the summertime. But you know, the milk is a big thing that's changing a lot because they're increasing the shelf life of these milk products, and it's a lot of our products. You know, they're just putting so much crap in it to have a longer shelf life.
The other day, I was on Twitch, which is like a streaming service, whatever, and I was watching a friend of mine that he streams on Twitch, and somehow the conversation of health came about, and I said something in the chat about raw milk, and he was like arguing with me, like, it's pasteurized for a reason, people die from this shit, like what? And I'm just like, dude, shut up. Like, yeah, you'll get diarrhea if your gut's not used to it.
Correct.
Start off slow, drink raw milk, tell me how you feel in a month, like, as opposed to, you know, whatever. I've always been a milk person.
Yes. And honestly, I never had an issue with milk until I had my lupus diagnosis 2 years ago. And it was very offsetting because I was like, oh my God, I can't have my milk. I can't have my yogurt because I love having yogurt. That was like my mid-morning meal. I eat the same thing every day. I'm so boring when it comes to eating, you know, that same here, like it's the same thing, but I look forward to my meals. And I was so upset I couldn't have my yogurt because I would have such a bad bloating, gassy reaction to it after the lupus diagnosis. So I didn't really tie them two together too until I learned more about it. But point blank is I started the raw dairy, the raw milk, and the raw yogurt, and raw butter, and I never have an issue with it. And a lot of people are like, oh, but I'm like, if you have a reputable farm, you're not gonna look. People buy chicken from Walmart and they have salmonella. Like, you know what I mean? Like that's not, that. I've been drinking raw milk for 2 years now.
Yeah, me
I have not had an issue with it once. Yeah, never once. And I have a UFC fighter that he would have dairy intolerances, and he was struggling to, like, because he looked forward to a yogurt meal. He looked forward to having milk in his routine, and that would help with like his getting his protein in and stuff, and his shakes and whatnot. And he would have such bad reactions to it. And I introduced him to raw dairy, and he was like, I would see him there on Sundays at Mirando, because he'd be like there with his family, and he would just be like, man, I can like finally eat foods that I wasn't able to eat. So we talk about that lactose, and here's the nutshell about raw dairy, right? When we pasteurize dairy and you heat it to a certain extent, that's why A2 is becoming a little bit more popular, because it's not as heated, so you're kind of not burning all the benefits of it. Yeah. But people feel a little safer having the A2 versus the raw. But we lose the vitamins. I think it's like you completely
have a chart, actually.
Denature the whey. I think you completely denature the enzymes. And then guess what? You denature lactase. And what is lactase? Anything that ends in ase in the medical world is an enzyme, right? And enzymes break things down. So lactose for milk. Lactase breaks down lactose, so breaks down milk in the diet. Yeah, and that's gone.
Raw milk versus pasteurized. So when it's raw, every single vitamin and nutrient and immune factor is 100% active in raw milk. Vitamin A, C, E, iron, zinc, B complex, whatever, everything. When it's pasteurized, there is anywhere between a 14% reduction to completely denatured and destroyed and completely inactivated in most of it.
Probiotics, right? For instance, everyone wants, get the yogurt and the milk when you have it. You know, you're taking antibiotics to get probiotics. You're just wasting your money at that point. Yeah. So that's another fact. And I get, a lot of people don't have access to certain farms, or, the money of it is expensive as well.
Do you think that if people can't get access to raw milk, they should just not have any milk?
Well, I think they should try the A2. If they have access to the A2, then at least try the A2. And I know Whole Foods and I think Sprouts and Publix are really starting to push that out. I don't know from up north.
There's a brand that,
There's I think the website, let me see if I can find the website for you. I have it on a PDF that I send to a lot of my autoimmune clients.
So overall health, everyone needs electrolytes, potassium,
water.
Sodium, magnesium, water. Do you think that people should always have a little bit of salt in their water?
I do.
Yeah.
Because the thing is that a lot of people think that drinking all this, well, especially down in South Florida, right? We step outside and you just start sweating.
Yeah, it's ridiculous.
And then people want to know why they're sluggish or they're tired or they feel like they're not, just completely drained all day. When they're like, but I'm drinking all this water. Okay, but how much are you sweating? How much are you peeing? Yeah. You're peeing it all out. You're just expelling it. Mm-hmm. So you need to have that balance. Otherwise, the water can't get into the cells and the cells can't do what it is they want to do. So now sometimes these cells are like full. They're overhydrated. And that becomes a problem too. So if they're dehydrated and they're very, very, I would say emaciated, these cells they look like I just like squashed like a bubble or something like that. Yeah. And then you have the hyperfluid cells. That's not good either because that's when you see the bloating. That's when you see you're holding water. That's all that other stuff. Or you're expelling the water. You're sweating it out.
Yeah.
Some people don't. They just hold on to it.
Yeah.
That's where you want the electrolytes to come in and allow that to have this interstitial barrier that allows everything to connect. Mm-hmm. We talk about neurons, axons, cells, talking. All that stuff flows better with electrolytes, and especially nerves. And nerves are what control our muscular system, and they control every factor of our hormones. They control the release of hormones. Mm-hmm. So if we have that balance of electrolytes, we're going to have a much better internal system.
Yeah.
Quality of the water matters as well. We could go down that rabbit hole as well. Oh, see, I have that chart here too. Okay, so the website, if you don't know about any farms around your area that might have raw milk, and they're pretty up to date on this website, it's www.realmilk.com, just like it said, REALMILK.com. And you'll find, you can put in your address, you can put in your zip code, and it'll give you something close. And some of these places are now shipping, like they have shipping locations.
Well, I also heard that there's a brand that's going to start selling raw milk at Sprouts, but they're going to sell it under pet food.
Yeah, that's how they have to do it.
Yeah, but but Sprouts is going to carry some form of raw milk.
It's amazing seeing the change. It's amazing seeing the change. It's really exciting to watch because I feel like we'll put a lot of hopefully the obesity pandemic and stuff like that,
or even just like overall health, because everyone is sick. Everyone has gut issues. Everyone has blood pressure problems. Everyone is dealing with something. Who knows?
I will say this. I think COVID has a lot to do with that.
100%. I feel like I got sick after COVID. Like, that's when my autoimmune stuff started, was after COVID.
Mine too.
I mean, it makes sense because that's where our immune cells are.
And my rheumatologist, him and I were so honest with each other. He was so cool. I should give you his name. I don't want to put him out here, but the best part was I walked into his office, and this was, I would say, 2021, and they were like yelling at me to put a mask on. And I was like, okay. Like, meanwhile, like we had been like pretty much going into places without masks at this point.
Yeah.
And so I was like, all right. Like, I didn't know, like there was no sign anymore or whatever. Mm-hmm. So I was like, okay, fine. Like, I came with one anyway, just in case.
Yeah.
But they shared an office. I think one day out of the week he was with this office. Anyway, I put the mask on. Chris was like, I'll wait outside. So I went in, and then in the room, he came in with his mask on, and he's like, all right, you ready to take this off? And I was like, okay, like this guy's like,
I like you guys.
Yeah, so this guy's like on top. But anyway, so whatever, he's like, take it off. Well, let's talk. And then we were talking, and he went over my blood work with me. We talked about everything and stuff. And I was like, it's just so weird. I was like, I feel like I got weak. Mm-hmm. Like, I went from being this animal, and like I got the floor swept out underneath me. And he goes, what's crazy about this virus? He said, is that he used to have like you could get in the same week with him. And he's like, I have a very thriving practice. He's like, but I always was able to get a person in or have some leeway with my schedule, this, that, and the third. He said, now since COVID, he's like, I'm booked out like 7 months.
Wow.
Because now we're having all these autoimmune issues.
And people don't even realize that it's autoimmune. Yeah. They just think it's like a regular part of their day. Why they like have a rash or sinus.
Aging or whatever they want to put it to. You know, that's a big thing that nobody's really looking at. You look at these. Well, I mean, they're really trying to starting to study long COVID or COVID long hauler or whatever they want to call it.
Yeah.
And, you know, it really ties into the whole autoimmune thing that's going on. But I have myself so many patients that I'm having these conversations with. And I'm actually helping this man. He's a patient of mine. She's actually a physical therapist. I'm treating her father virtually because she wanted some oversight with him and stuff. And he had gotten the vaccine and then he was hospitalized. And he's now is getting back on his feet and stuff like that. Or I think he got vaccinated, then he had the booster, and then after the booster is when things hit the fan. I mean, lost all the muscle tissue. He lost use of his larynx in his throat. They had to put him, like, he's been doing all this speech therapy. He's got stimulation and he's getting it back, but he lost the proximal stability of his muscles from this vaccine. And it's just crazy. It's scary because it's like you're damned if you do, damned if you don't. So it's like you get the vaccine, you could have this stuff, or you could get COVID. And you could possibly be in the hospital, depending on what your genetics look like. Or afterwards, like you and I, unfortunately, we have those genetic predisposition to autoimmune disorders. And now all of a sudden you get this virus, you know, this strand that just turns on.
And we're so aware of our health and our bodies that we know exactly what it is. Correct. Like we can, this is this pain, I know what this is. Right. And a lot of people aren't like that, and they're just like living their lives with chronic pain or stomach issues or digestive issues or rashes, skin issues, psoriasis, whatever it is, and they're just like, it's just part of my life.
And like, the best is when patients are like, I'll be like, well, okay, how much pain are you in? And they're like, I'm always in pain. Yeah. And I'm like, okay, but that's not normal.
Yeah, you're not supposed to live in pain.
We're not supposed to be in pain.
With your skin falling off. Like
correct. Like, you know, you should not have rashes, you know?
Yeah.
So yeah, I mean, that's a big part, but.
Yeah. I mean, you know, I be arguing with my friends all the time about this.
Yes. Yep.
But, yeah, I mean, I was going to ask you, like, a piece of advice that you can give anyone to better their health, but we already said. How important do you think the gym is?
Very. Going back to earlier in the podcast.
If you had to split gym and diet, what's the percentage? Like, do you think it's, like, pretty much balanced, or it should be?
To me, it should be balanced, honestly.
I think so too.
Honestly. Like I said, I think muscle is a big predictor when you talk about longevity with living and lifestyle. Now, if we're talking back in the 90s, maybe it wouldn't have been as bad. When you talk about, I don't know, going back maybe further than the 90s, but, you know, our food is so plastic now. All the materials, the fragrances, all these companies are being bought out by these big...
Have you seen the videos of the rubbery avocados and stuff?
Yeah.
Like, what?
Yeah, they're just genetically modifying a lot of stuff, and I don't mean to go on your podcast and...
I love it.
Go on my soapbox of what's wrong with the world and the pharmaceutical companies and go down this rabbit hole of, she is on that trail.
She's one of those.
She's the freaking tinfoil head person. Yeah. But it's true. I mean, and listen, if
this
for
is
any
not a conspiracy,
right? For any of you guys listening, it's real though. It's, I mean, myself, I'm going through it. Vanessa's going through it. A lot of my patients who are going to listen to this, they're going through it. You know, it's really tough to see, and you know, we're seeing a lot of it. So you can't even really hide it. Like if you were one in like 2 billion people that had it, I could be like, all right, cool. Like you're probably crazy.
It's only
but
if you're in absolute denial of what you're going through is the only way you're going to hide it or whatever. But if the moment that you become aware of what's happening in your body, that's it. Like,
well, and again, it's not so, it's also like, I think the biggest thing is if you have the muscle, right? Because your brain's a muscle, your heart's a muscle. if you have the muscle and then internally you're feeding your body what it needs. It's like if I have a car that requires 89 and I'm putting 87 in it and I'm burning gas, like that's pretty much what we're doing to our bodies when we put crap into it. So then you talk about the mental part, the psychological effect after having all this toxic stuff, all these products that we don't even know the names of that are made in a lab. And then you want to know why this person has depression or bipolarism or schizophrenia or, anxiety. Like we think of how is that playing a role now into all that? Did they have, her mom was bipolar. Okay. But like maybe she didn't need to go that route if she hadn't gotten sick and had all these issues and ate like crap. I have another patient. She had been officially diagnosed with MD. Her father died from MD. Her brother and sister have MD, and she's doing fantastic. Now she has some signs and symptoms, like she has weakness in her distal limbs, like her fingers and stuff, her grip. And at times she's undergone she had to undergo a procedure and it weakened her throat a little bit with like talking and swallowing and stuff like that. She had a little bit of dysphagia, but it came back very quickly. She strength trains 4 times a week. She has a trainer. She eats super healthy. Yeah. She does drink on the weekend, whatever. She knows it's not like the best thing for her, but her brother and sister, when they were in their early 40s, like she is, one's in jail. One has like no use of his limbs, hands. He's got heart issues. She's barely making it and holding on, but they don't take care of themselves.
Yeah.
So there is something to be said about that.
So she's doing amazing because of the way she eats
and trains.
Yeah.
She's keeping the muscle strength.
Yeah.
And when it comes to something like MD, where it's a neurological progression, unfortunately, of the disease, she's really halting it. She's regressing it. You can't argue that.
The proof is in the pudding, guys.
Correct.
Yeah. I mean, and I'll talk about this on a future episode, but yeah, the diet has changed everything for me, because before, and then people say, you're crazy for eating that boring, that much meat, you don't drink, you don't, what do you eat? You can't eat anything here, and I'm like, to me, it's not worth it. I know what I felt like before. I'm not going back to fucking convulsing in my bed, not knowing what's happening. Now I have a symptom and I'm like, great. All right. And then I drive you crazy and my mom crazy. And then you guys
we're okay.
Yeah. Then you guys convince me it's not an organ and I'm like, sweet, whatever. And I just go to sleep. But it's like you learn what to do for yourself. And like people don't realize like what you were saying psychologically too, like the gut is connected to your brain. Almost every issue starts in your gut. So why not heal your gut and then just see how you feel? Like, just see if you might have to get off medication. Like, there's this doctor that wrote this protocol GAPS that you know about. Yep. Dr. Natasha Campbell McBride, if you guys want to Google or buy her books on Amazon or whatever. And the gut and physiology syndrome is what GAPS stands for. This woman cured her kid of autism with diet. Autism, ADHD, depression, anxiety, and then down to the skin, psoriasis, rashes, whatever it is, and then internally just all these issues. But yeah, I'm not sure why.
Well, you know what's crazy when you say that too? Like, when did we in society normalize what's normal? Like, just because I eat the same foods every week and I go to the farm and I drink my raw milk and I drink my dairy products and I, have grass-fed beef and whatever. When did it become the norm to eat like shit, to drink Gatorade, to, drink alcohol, like to socialize? Like the only way you could socialize is if you had a drink in your hand. And I just, that's where I think the problem is. Like what you and I are, or how we're eating is normal.
Yeah, like we're eating normal
that's
food.
What you should be eating.
Yeah, like we're not eating shit. We're eating normal food. We're eating vegetables. We're eating meat.
Correct.
All kinds of meat. We're not just saying we only eat beef. Like we eat chicken, fish, shrimp, whatever.
Wholesome organic food.
Yeah, like we just eat real food. And like people look at me sideways when I'm like, no, I'm not eating that. I went to a birthday dinner yesterday and I sat there and drank water. I ate before I left. Like, is it a problem for me? No. And I watched everyone around me eat French fries and quesadillas and burgers and whatever. And I was just in the conversation. Like, and then I got home and I had chicken and some vegetables and that was it. And I went to bed.
For me, when I was bodybuilding, that was the toughest because, you know, I would go to a family function. Like, I think I was competing through like Thanksgiving or something like that. And I had to like make my food and I brought my Tupperware and my mom was like, what are you doing? Why do you have Tupperware here right now? And she would be really irritated when I had to like cook fish for like morning, lunch, and dinner because I was staying at home a little bit when I was doing one of my internships.
Was it like tilapia at the time?
Oh, she was like, she was like, I can't believe you're cooking fish at 9 o'clock in the morning. But it really helped during this time period of my life. And plus, you know, with Christopher, him and I met bodybuilding. And he's very picky eater. Like, he likes basic food. Like, he doesn't like... He's, like, so easy to cook for. So, for me, it's like, yeah, we're having ground beef again.
Yeah. Yay.
Like, what does your wife cook you? The same thing every night. Yeah. And eggs.
And I love it.
Eggs, yeah. So, that's helped our relationship a lot. I think if you guys can get on the same page at home, like, if you have kids, too. You know, I don't have kids, but, you know, if I were to have kids, I think that I would be able to say like, hey, so, you know, I think that like if you start these kids at a young age of what's normal, if you're starting your kids off the minute they're born with sugar and popsicles and all this other stuff, they are going to think that is the norm. And then that transfers into their kids and generations after that. And that's where these generational problems come in.
And then when you try to get them off of all that, and now you have another problem on your hands.
Correct. And then you want to know why your kid's allergic to peanut butter or your kid's like this.
Yeah.
So, you know, that's where I think, like I said, there's got to be a balance between it all and there's got to be a norm with it. Yeah. But like that, it's just, we got so far away from what is normal.
Have you walked through the aisles of like a grocery store recently? Like through the middle aisles?
No. I can't tell you really the last time I've been through there.
Yeah, so obviously everyone knows the outside of the grocery store is where all the meat is, dairy, blah, 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 and whatever. You don't really need anything in the inside aisles unless you're getting like some kind of cooking oil or something.
Right.
Every time I walk through those middle aisles, I'm like, it's like, for me, it's like walking through a museum. I'm like, wow, look at this. Look at these Oreos. What the fuck? When did they make? And I'm like, and I just read the ingredients sometimes, like literally when I'm bored. And the amount of shit that is available for people to buy and consume is crazy to me. Like, I look at it and I'm like, this doesn't even look good. And don't get me wrong, I'm the first person to tell you, I fucking love Taco Bell. Like, when I used to smoke and 2 a.m, DoorDash some Taco Bell, that was my shit. And now I look at it, I'm like, I know you're delicious, you're not even worth it. Like, right. I don't even want to.
Well, that's the other thing. Like, I don't even want to, like, when I look at it, I'm like, $15 are these, like, well, I'm not spending my money on that.
Yeah.
You know, I'm not. But it's just, we kind of got to go back to, like, older times. From the aspect of we have to go back to eating real food again.
And that's the thing is like people's minds. I think that for most people, we went completely, you know, we're
off the deep end.
Derailed, but whatever. Most people, they're fine with eating real food for breakfast, lunch, and dinner. Most people can eat eggs and bacon in the morning, not have a problem. Most people for lunch can have a chicken salad, not have a problem. A piece of chicken, a vegetable, not have a problem. Most people can have a steak for dinner and a sweet potato, not have a problem, or whatever they're eating. It's the snacking in between, I think, that's what fucks people up mentally. Because then they're like, wait, but if that's all you eat, what do I eat in between those things? And in reality, when you're eating really good meals, you're not going to be hungry for fucking snacks.
Correct.
Like, I don't snack during the day. I used to when I ate whatever. I had chips in the middle of the day or whatever it was. Now, if I really want a snack, like really need one, or I'm in a hurry and I don't have... I'm like, let me grab a beef jerky and eat some yogurt. and I'm still satisfied. I'm still getting like the salty sweet thing that we all like to do, you know, whatever. But I think snacking is what fucks people up, because you start to think like, what little crackers can I have with this? Like, just eat the cheese. You don't need the fucking crackers.
Yeah.
Like,
there's something to be said about like the other aspect where people will come to me and be like, Doc, but it's, you know, I don't have the time, and you know, oh, but I gotta pack this stuff and blah blah blah. And it's like, okay, I used to commute from Long Island into the city to work a job 8 to 4:30 where I did not get paid, and then I would come back to Long Island and I would have to train because I was bodybuilding. I would literally carry a massive lunchbox throughout my day. And sometimes I would have to eat my meal cold because I wouldn't have access to a microwave.
But that's the difference between people who have that discipline.
Correct.
And some people, they just either don't have it or they don't want to learn it, like, because it's not convenient for
and then
them.
Look, if that's the way you're okay to live, and that's your option. That's your choice.
That's what I tell people. If you feel
right
100% and you feel like you're fucking thriving and you feel great, okay, then keep doing you.
Cool.
Yeah.
But more than likely they don't.
Yeah. More than likely they have back problems. More than likely they're having some sort of flare up that they're not aware of.
Or they're constantly having flare ups. You talk about healing from physical therapy. The ones that heal the best. Oh, go back to that electricity machine, that PEMF machine, the Electrons Plus, right? The patients I connect to, like, with the lowest, I could put you on, like, a very lighter frequency wavelength. The ones that have electrolytes in them, the ones that have more muscle tissue, I'm, like stuck.
Really?
And that muscle just, bam.
Because their frequency
They're
is
so
higher?
healthy. Because the tissue is healthy. If I have someone that is dehydrated, I have someone that's got hypertension, I have someone that's obese, I do not get a good connection with them. And that is but like, I can't even make that up.
Yeah.
It is like,
thing.
And then I'm at the machine trying to increase it, but then my hand's burning because I'm the one that's more healthy internally. And I'm like, I can't increase it anymore to like get some sort of reaction. Yeah. So it's almost not worth sometimes doing it. But you know, obviously there's a signal that's sent through them because of the polarity of the body, but you can tell the difference between someone that is healthy internally versus not with that machine.
That's crazy.
Yeah, it's nuts. It's very nuts.
I love that machine.
Yep.
I have an appointment with you next week. I can't wait. So before we close, anything else? I'm going to tag all her socials, even though she doesn't care about social media. But you guys can go follow. She does post videos about what she does.
Yes.
Her clients are always posting, and you share it on your story, so you guys can go see the needles. And
you'll see a lot of Chloe. My dog actually just had ACL surgery. Yeah. They call it TPLO surgery. So I post like her recovery and stuff. And it's funny because she's on an all carnivore diet and you've
been treating her as well as her therapist.
Yeah. So she's doing great. Yeah, she's phenomenal. But the same with dogs, man. You want to feed them crap, they're not going to be healthy, or they're not going to have a longer lifespan. And it's amazing. Yeah,
our little pups.
Yeah, they're our babies.
But thank you guys for tuning in. Appreciate you all. Thank you,
Vanessa. It was fun.
Thank you, Christiana. I'm glad you had fun. Go follow her. We'll tag everything below in the description, and see you guys next Friday. Bye.